Every birth is different and things may not go as planned. If problems happen, your healthcare provider may recommend a C-section or cesarean birth. It's a good idea to learn about C-sections early in your pregnancy so you feel prepared. A C-section is a surgery where your doctor makes a cut in your uterus to deliver the baby. There are different reasons why a C-section may be needed. Some C-sections are planned. This means you and your healthcare provider have decided ahead of time that a C-section is the safest option for you and your baby. If a C-section is planned, you and your healthcare provider will talk about the surgery beforehand. You'll also want to talk about your birth plan. Write down your wishes for the delivery, like immunizations, skin to skin, and when your baby will be bathed. Tell your healthcare provider if you want to breastfeed. You may have a say in these things if your C-section is planned. Sometimes, an emergency C-section is needed. This happens if there's a risk to your health or your baby's health, and a C-section is the safest option. Emergency C-sections happen quickly, and there may not be a lot of time to ask questions. That's why it's a good idea to talk about C-sections with your healthcare provider early in your pregnancy. Here are some questions to ask. What problems can happen during a C-section? Can it affect future pregnancies? Can I have a vaginal birth after a C-section? What happens during a C-section? How long does it take? What kind of anesthesia will I have? Why would you have an emergency C-section? What is the recovery like? Will I have scars? Can I eat before a planned C-section? Can my partner and labor coach be in the room with me? Will I be able to be with my baby right after the surgery? No matter what your birth experience is, the more prepared you are, the calmer and more confident you'll feel. Talk to your OB/GYN or healthcare provider about C-sections so you know what to expect.